Okay, so today I'm going to talk to you about urinary catheterization. And before I start with opening my catheter tray, I'd just like to review with you a couple things. First of all, urinary catheterization falls within one of the three controlled acts that nurses can do. And so in order to do that, a nurse would require physician order to do that. So we have our physician order here, and that order might be a standing order in terms of a procedure within such and such period of time. Urinary catheter could be inserted, or it could be an actual immediate order. Sometimes the doctor orders the catheter to be just what we call in and out, where the catheter would not be hooked up to a drainage bag, or sometimes it would be. Sometimes the physician will order a certain size of catheter as well. So all of those things are important before embarking on that procedure. Just to show you some of the samples of catheters that we have, sometimes we have more flexible catheters. This, of course, wouldn't be sterile. Or we could have a less flexible catheter, and there are also metal catheters. If there is only one lumen, that means that the catheter would just be used as an in and out, and it would not be hooked up to a drainage bag. In addition, we have some catheters come in packaging and actually have the size of the catheter written on the side of the package, and in terms of how much fluid to fill the balloon at the tip of the catheter, that is also recorded on the packaging. This is a 2-lumen catheter, so it could be hooked up to a drainage bag. This catheter has actually 3 lumens, and that would be if there was a drainage bag hooked up, but also perhaps an irrigation bag of fluid as well would be hooked up. So that's a 3-lumen catheter. So the other thing that's important to remember is if there is a drainage bag, if the drainage bag is hooked up to the bed, or perhaps if the drainage bag is going to be hooked up so that the client can walk around with it in terms of a leg bag. That would be something else to consider. And that's actually a nursing judgment in terms of whether the patient would want a leg bag so that they could walk around at home with, or a urinary drainage bag. Typically the leg bags don't hold as much urine, so need to be emptied more frequently.